Good afternoon. My name is Kanyisile Padindlela, and today I'm here with.
Nelan Dinake.
Hi, Mr. Dinake. How are you today?
I'm good, thanks, and yourself?
I am good. So, if you don't mind, I'll be asking you questions regarding the performance of the GNU.
Not at all, ma'am.
Okay, we'll be focusing on the healthcare sector. And with that being said, are there any public healthcare services in your proximity?
Yes, we have a public hospital called George Mukari in our community.
What is the state of the hospital in terms of maintenance and cleanliness?
The maintenance is very bad, I would say, unsanitary outside, and the building needs maintenance.
Do you think the healthcare services are easily accessible to everyone?
Yes, they are. There's no operation to do that, hence it's overly packed. Anybody can get services there.
You mentioned that it's overly packed. With that being said, have you ever experienced a shortage in staff or medicine at the hospital?
Yes, both actually. Hence, it was overly packed, meaning there's a shortage of staff, and there was a shortage of pills when I went there on the specific date where they told me I should get the pills.
With the staff shortage, how long does it take to be seen by a doctor or a nurse at the hospital?
It took me 6 hours to be seen by a doctor there.
6 hours is a lot of time. How do you feel about only a small percentage of the population has the privilege not to be waiting 6 hours and experience private practices, whereas the majority are at public hospitals?
I feel like it's not a good thing. I feel like healthcare should be equal amongst everybody, and whether it's public or private, I feel like healthcare should be a basic need to everybody.
What is your take on the professionalism of the healthcare workers at the hospital?
I feel like they're unprofessional. I feel like they are judgmental towards us, the people that went there to test ourselves for STIs and STDs. They're very negligent. The staff members were always on their phones. They didn't provide proper attention to us unless you were hurt badly or bruised up or bleeding really badly.
All right. Do you think the government's emergency medical services are effective? And this is referring to ambulances, etc.
No, I feel like the ambulances take way too long. There was an incident earlier this year when my cousin had fainted and we called the ambulance, but it had taken way too long for to come here. Luckily, my neighbor was there to help us out to reach us to the hospital.
Do you think the GNU educates people about healthy living, vaccination programs, and disease prevention enough?
No, I feel like they don't, because there are still people in the community that aren't aware of their health risks, and they only provide those type of informations basically in schools, where in the communities there aren't that much evidence provided due to these healthcare issues, and we have the lack of education in the community.
With everything that we have discussed in the interview, what do you rate the GNU's performance in providing and improving healthcare in South Africa? Is it good, average, or bad, and why?
I feel like it's average. They cover some of the things sometimes, but as I mentioned throughout the interview, there is a lack of basic needs such as sanitary pads for young girls. There is a lack of knowledge regarding health in the community. We need more medical supplies, staff, and transportation, such as ambulances in case of emergencies.
Thank you so much, Mr. Dinake. It was a pleasure interviewing you.
Uh, thank you.